My name is Claudia Delbasso. This presentation will focus on the Yale Psychoeducational Clinic. The presentation will follow this outline. I will discuss key motivators for the creation of the Psychoeducational Clinic, the creation and activities of the clinic, and finally, I'll end with the lasting impact of the clinic. Key motivators for the creation of the clinic. Around the 1940s and 1950s, only medical doctors were allowed to train as psychoanalysts. In the 1950s, psychiatrists began to expand their view of what constituted mental health treatment and who could provide treatment. This provides context for persistent concerns that despite the need or desire for help for mental and emotional health, there was an insufficient supply of mental health workers to meet the demand for services. There was a scarcity of mental health workers in low-income communities, and there was skepticism about the efficacy of therapy and validity of diagnostic tests. Importantly, there was a concern that current modes of practice may be inadequate and/or produce harm. Around the time, there were also critiques of the overemphasis and almost exclusive focus on the individual at the expense of social context. This also fueled a sense of need for a different direction. This quote reads, "In the early 1960s, the assumptions were that important events involved in problems of living were almost exclusively intrapsychic in nature, and to treat these problems required psychotherapy. Situational determinants of problems were overlooked, the strength of environmental events to foster constructive change underestimated, and the problems of transferring gains from the psychotherapeutic situation to daily life ignored." Creation and activities of the clinic. Seymour Sarason, pictured here, founded the Yale Psychoeducational Clinic in 1962. Mental health professionals began focusing on problems of institutional and social change around the time that the clinic was founded. This clinic was the first community-oriented, university-based clinic in the U.S. and exemplified the overall shift in psychological treatment around the time, focusing on social change. The clinic aimed to understand settings within the context of history and culture of the community that was being served. This included a focus on diverse populations in terms of political, economic, and racial and religious identity. Sarason described the purpose and the thoughts about the clinic at the time of its inception. Mistakes would be inevitable, if only because we were giving up the clinical stance and its emphasis on the individual client in need of repair in our offices, and trying to become part of the turf of others for the sake of learning and helping. We would consciously be forging a new professional identity, a process as conducive of mistakes as it was of new knowledge. We wanted to become a new kind of psychologist, except that we did not know in any concrete sense what that kind was. This quote exemplifies a guiding purpose of the clinic, which was the development of a research program concerned with two broad questions. 1. How do we determine, understand, and describe the culture of the setting? And 2. How do we introduce change into an ongoing social system? What else was unique about the clinic? It worked with community organizations. Although some clients came in to receive psychological services in the clinic, most of the work was done outside of the clinic with community organizations such as schools or juvenile correctional institutions. A big focus was in understanding and collaborating with the community that was being served, rather than acting as expert. Another focus was the creation and sustainability of alternative settings. For example, the Regional Center for Individuals with Intellectual Disabilities. The clinic was symbolic of a paradigm shift around psychological perspectives. Sarason and the clinic staff focused on studying how settings were created and factors that influence their longevity. He investigated this by acting as a participant observer who collaborated with various organizations to help solve problems. For example, low student academic performance or low recruitment for programs. The focus was on understanding and changing settings, rather than changing something inherent in the individual. There was a strong emphasis on collaboration with organizations to solve problems, and the overall shift was from describing and fixing problems inherent in the individual to preventing problems before they begin and promoting well-being. Overall, the focus was on social change and how this would promote overall well-being and prevent individual suffering from occurring. Dick Rapucci, Ed Trickett, and Seymour Sarason were three of the main professionals at the clinic around the time it began. Weinstein, a psychology intern student at the clinic, described that the clinic felt like a new world, a place in which the focus was on social settings, their impact on human behavior, and social change. Her mind was open to the possibility of preventive intervention at a systems level. She learned from Dick Rapucci's focus on the principles of institutional change, Ed Trickett's power of ecological theory, and Seymour Sarason's focus on the creation of settings and universals of schooling. Lasting impact of the clinic. The clinic served as a pioneering setting for community psychology from the early 1960s to the mid-1970s. For the following decade after the creation of the clinic, many of the ideas that fueled the development of the field of community psychology originated in this setting. For example, sense of community, creation of settings, preventative interventions, collaboration and community strengths, and value and respect for diversity. Preventative approaches in mental health planning and programs and community action strengthen the emphasis on ecological levels of analysis to inform the consideration for problems in settings rather than a problem in an individual. Further, there was recognition of the value in thinking about the system and environment in which an individual exists, rather than conceptualizing an individual as existing in a vacuum. Sarason, Levine, and colleagues wrote the book, Psychology in Community Settings, to describe their initiatives and work throughout their time at the clinic. Sarason wrote, "This book served as an initial guide to many psychologists who wanted to move from a repair strategy for individuals to an early intervention strategy whose goal was the development of growth-producing, prevention-oriented human service settings."